How can physicians build relationships and boost patient loyalty? Find out on Medical Economics.
Because I think many physicians don't understand that. They think communication, and providers for that matter, communication is about asking the right questions. And it is, and that's what we're trained to do. They don't understand that the nuances of communication, verbal, nonverbal language, tone, cadence, are just as important, if not more important. So the first step is understanding communication is important.
Physicians spend years undergoing rigorous training to diagnose and treat complex health conditions. But once they begin practicing, they spend a great deal of time alone in an exam room trying to convey health information to patients in an effective and compassionate way. Communication is a soft skill, one very different from the hard scientific and medical knowledge most doctors focus on. But it's vitally important. Conveying information clearly and with a human touch has a direct impact on patient adherence and, ultimately, health outcomes. So what can physicians do to improve their patient communication? Today, we sat down with patient communication expert Dr. Anthony Orsini to discuss practical strategies physicians can use today in their practices. Do physicians actually struggle when communicating with patients? And if so, why?
Yes, I do feel that physicians often struggle with their communication skills. And I believe that to be because it's just not emphasized when they're training. We teach physicians how to communicate with respect to how to take a good history and to how to ask the right questions, but we don't teach them how to communicate to build that rapport and build that relationship. Once you have a relationship, then you have loyalty, and then you have patients who return to the same hospitals, patients who return to the same physician. And so what I do with the Orsini way is to teach them how to connect, not just what words to say, but how to say them.
What's the relationship between patient communication and patient outcomes?
We know without a doubt that if you have a relationship with your provider, whether it's an organization or a physician, that you're more likely to follow the prescribed treatment, to follow up with your patient, and to take the medication that the doctor prescribed. And so it's really very clear that communication forms relationships and really results in better outcomes for the patients. That's clear.
In a world where patients are approaching healthcare more like a consumer, how have their expectations in communicating with their physicians changed?
It is no longer acceptable to today's patient to have a skilled doctor with a bedside manner. They really want both, and they deserve both, frankly. So now we have online reviews that are readily available to patients. There are government patient satisfaction scores that patients can look up to see how the providers are doing. And so we really have a more knowledgeable consumer. And so communication is extremely important, because if you don't make that connection with that doctor, you're not going to return.
What are some of the key mistakes that physicians make when communicating with patients?
One of the big mistakes that physicians make, especially within a hospital when visiting a patient in the hospital, is to just not sit down. We think that by standing up, we're saving time, when actually patients' perception of how long you stayed in the room is twice as long if you sit down than if you stand up. And so something simple like grabbing a chair, sitting down, can really go a long way. The second piece of advice I would give is to not multitask. We know that multitasking is actually a myth, that you cannot do two complicated things at one time. And multitasking causes more medical errors and actually slows you down. So my two biggest pieces of advice would be to sit down, give them your undivided attention, and don't multitask. And I think you'll do really well.
Technology was supposed to improve patient communication. Has it?
It has not. In fact, it's driven a wedge between the human interaction between a patient and a doctor. The laptop is right next to the desk of the doctor, and it's very tempting for that physician to go ahead and type into the electronic medical record while their patient is speaking. And as I mentioned before, when you're typing in the electronic medical record, your patient feels that you're just not listening, and they're really unlikely to form a bond with you. You're also missing the nuances verbal language and the patient's tone and their face. And you can get a lot more information out of a patient if you're just watching them as they speak to you. So multitasking, especially with the electronic medical records, is a bad thing. Do your exam first, speak to your patient, and then go outside and do your electronic medical record. I think it's a good thing when patients are able to go into a portal and speak to their doctor, send their doctor an email, et cetera. Those are good things, but it shouldn't replace that personal interaction.
A complaint we often hear from physicians is how EHRs are in the room between the patient and the physician and how much this essentially annoys them. What strategies do you have for physicians to make sure that the patient comes first in the exam room and not the EHR?
My advice would be to leave the electronic medical record for later. So treat your patient, listen to your patient, speak to your patient in a caring, trusting manner, and then when you're done, you can go ahead and fill out your electronic medical records. I think we are also underutilizing quality scribes. A lot of hospitals are now using scribes so that a person who is very trained can type into the electronic medical record and allow that physician to give undivided attention to the patient at the same time. So that's one thing that some organizations are moving towards.
Patient communication obviously goes beyond just the physicians. What can physicians do to make sure their entire organization communicates efficiently and in the same way with patients?
It's extremely important that everyone in the hospital or in the organization get trained on how to communicate. And hospitals have made mistakes by hiring third-party people, usually from the hospitality industry, to train their receptionists, their physicians, their nurses, and their security guards how to speak. The problem with that is that they're often told what to say. And so when I do my training with the Orsini Way, we don't tell the receptionist what to say, but we teach them how to communicate, that it's about building that relationship and to make someone feel that they're welcome. When someone goes, no one wants to go to a hospital. No one wants to go to the doctors. It's not a hotel. So we don't want to speak in scripts. We don't want to be shallow. We want to teach the receptionist, the security guard, the housekeeping woman, the physician and the nurse how to interact with a patient or a patient's family and build trust and let them understand you're in good hands. And it's not shallow, that we really do mean it.
What can physicians start doing today in their practices to improve their patient communication?
Well, the first thing they can do is to understand how important communication is, because I think many physicians don't understand that. They think communication, and providers for that matter, communication is about asking the right questions, and it is, and that's what we're trained to do. They don't understand that the nuances of communication, verbal, nonverbal language, tone, cadence, are just as important, if not more important. So the first step is understanding communication is important. The second step is then to start training our young physicians on how to communicate and how to build that relationship. The problem is we have senior physicians who've never been trained. And so it's going to take some time to change that culture. And so I've trained thousands of doctors, both young and old, how to communicate, but we have a long way to go. I think the biggest thing hospitals and healthcare providers need to do is understand this is important. Press Ganey found that patient experience is 5 times more likely to affect loyalty with the healthcare provider than marketing. And that's astounding. And patient experience is about communication. So we really need to, it's a culture change, and it's going to take some time, and we're going to have to train one doctor, one nurse at a time. But it can be done. But the hospitals have to understand that their healthcare dollars are much better utilized by teaching everyone in that hospital or organization what communication is about and how to do that. You can save a lot of money. It's not about the color of the walls or how comfortable the chairs are in the waiting room. It's about when you come into the hospital or you come into the physician's office that you're feeling sick, you don't want to be there, that someone says verbally and non-verbally, I got you, you're in the right place. And once that happens, patients will be loyal. They'll be loyal to their doctor, they'll be loyal to their healthcare organization, and the healthcare organization is going to do well.